Hi, my name is Mike Penna, and today we're going to be talking about gonorrhea. It's going to be the second in a series of 3 sexually transmitted infections that we discuss. This presentation has graphic content and may not be suitable for all audiences. So this is a picture of gonorrhea. It's kind of an interesting little guy here. So there's the two spheres, and they're connected to each other with these extensions. And this is a very classic presentation of what you see when you're looking at gonorrhea. So what is gonorrhea? It's the second most common sexually transmitted infection in the United States, and its formal name is Neisseria gonorrhoeae or gonorrhoeae. There's a couple different ways you can say it. Mandatory reporting. So along with chlamydia, gonorrhea, syphilis, they're all mandatory reporting because they are becoming problems in our society, and the CDC has seen this. So they now require all healthcare providers to report these. This is known as the sneaky disease, and it's for a couple of different reasons. One of them being that it has a way of blocking the immunological memory. It also has a way of making its way very rapidly into the system. So whereas the bacteria, the chlamydia bacteria is more of the silent disease, this one is the sneaky disease. So how common is gonorrhea? It is very common. It's the second most common, in fact. In 2014, there were 350,062 new cases in the United States, and these are just the ones that were reported. They estimate by the CDC approximately 820,000, and they say that probably about 540,000 of those are between the ages of 14 and 25. So if you've already watched the chlamydia presentation, then you'll know that these numbers, although they're not as high, they are very similar as far as what's reported, what's not, and then the age groups. So here's a very good representation of how prevalent this is in our culture. So this is from the 1940s during World War II. Soldiers were getting gonorrhea just left and right. So as a way to combat that, the Department of Defense came up with these ad campaigns. And so these were targeted toward men and women. And basically they were trying to get everybody to get the penicillin shot, get rid of the gonorrhea, and they would then not have to worry about their soldiers having problems when they were overseas trying to fight. So how do you get it? Just like chlamydia, it's a sexually transmitted disease. So, of course, unprotected sex, either vaginally, orally, or anally, and passing it from an infected mother to a baby. Those at risk for gonorrhea are the same group that is at risk for syphilis as well as for chlamydia. Women under the age of 25, those sexually active, the ones that fall into the lower socioeconomic status, African Americans, and Native Americans. So this graph here is from 2012, and it displays chlamydia and gonorrhea both. And you can see where gonorrhea, although it is still a problem, it's not as bad as with chlamydia. And in the same age groups as chlamydia, you can see that it's more rampant. Also, the male to female ratio is not as large, and a big reason for this is because the symptoms on this one are a little more prevalent, especially for women, and so they're more likely to notice it and therefore have it treated. This graph here represents just one county, but it's over a period of time that's pretty interesting. So from 2010 to 2015, it's looking at, so 5 years, and then it's looking at a various array of ranges for ages, and it really kind of gives you a representation of number of cases. And again, it represents that there's certain age groups that are more at risk. This is reporting cases by state, so you can see where the higher numbers are. Some of the higher ones, again, just like with chlamydia, down in the South, California, Alaska, a little bit peppered in the Northeast as well. So this one here is nice because it actually shows you from 2000 to 2014, and it shows you chlamydia, gonorrhea, and syphilis. So here you can actually see the rise where chlamydia was fairly steadily increasing over the last 14 years, but the rise of syphilis in roughly 2010, 2011, it skyrocketed. It's actually becoming a really big problem now, especially for men having sex with men. Now, gonorrhea, of course, is down at the bottom, and it's kind of steady where it's at. It hasn't really changed a lot. So the way gonorrhea works is going to be a little bit different than what we learned for chlamydia. So it is small, it's gram-negative, but it's not intracellular, so it can survive outside the cell. It's referred to as a climber, and we're going to go into a little graphic in a second and kind of explain that. So it uses those extensions, they're called pilus, and it uses those to climb, and it will continue to climb high within the various tracts in the body. It has the ability, because of OPA proteins that are on the surface, the white blood cells, when they come by, they have OPA receptors. And so those OPA receptors, they will bind to those. And when they bind to those OPA receptors, the white blood cells are not able to make memory of this infection. So every time you're infected, it's like you're starting over, like your body's never seen it. That's what makes gonorrhea kind of interesting, and that's one of the ways that it actually protects itself. And then, of course, just like with chlamydia, you can end up with apoptosis and then the spread of the disease. Okay, so here you can see where we start out with the graphic here, and it kind of shows what the inside of the vaginal area looks like, with those little green dots being our gonorrhea. Now, when we go to this graphic here on the right, you're going to see that the gonorrhea have their little pilus, or pili, which is their plural form, and they're going to actually climb this wall, and they're going to continue their way up the tract. And they can either be absorbed in the actual lining, so they can be pulled in through endocytosis and then become inside the endosome, and so they can replicate that way, or they can be actually attacked by the white blood cells, and then this starts the inflammation process, and then this is where you're going to get a lot of the signs and symptoms that kind of come from that, is actually from that inflammation process. Okay, so just like with chlamydia, the symptoms are very similar. You usually don't have symptoms. It's not as prevalent. So with chlamydia, for women, you didn't see symptoms in about 80. For gonorrhea, it's closer to about 50%. But still, a lot of women don't report symptoms. The thing here, though, is that it is going to change from chlamydia, is that they're going to have abdominal pain. They're very common to report abdominal pain and difficulty urinating, as well as pain while urinating. They're going to have bleeding, which typically with chlamydia, you do not have bleeding. The discharge pus is going to be much greater than it would be with chlamydia. It's very noticeable and can even be described as having kind of an off color and odor. Painful intercourse is another one that's really prevalent with gonorrhea. When women have sex and then they complain that it hurts, a lot of times they can think that maybe they didn't use enough lubricant or something, but in fact, that actually is a sign that they have gonorrhea. Just like with chlamydia, you can have cervicitis, vaginitis, inflammation of the pelvic structures leading to pelvic inflammatory disease. Ectopic pregnancy as well, but not as prevalent as it is in chlamydia. You can also have infertility, and you can also have trachoma. You can also have a coexistence of infection here. That's why trachoma is mentioned. Chlamydia and gonorrhea are both opportunistic, so when you have the one, there's a very likelihood that you could get the other one. They would create the right environment, and then typically the same kind of people that are carrying the one disease also have the other. Arthritis is another thing that you can get from that co-infection, and then of course the HIV complications, like before. If you're immunocompromised, anything that attacks your system is going to hit you much worse. For men, it's going to be the same kind of thing, usually no symptoms, around 50%. For men, the big one here is going to be the urethritis. And so the difference from here and the chlamydia is that with chlamydia, they'll have a pain when they urinate, but it's described more as a pain. With this one, it's going to be more of a burning sensation. You can also have the prostatitis if it gets up to the prostate. Dysuria, again, pain with urination, the infrequency or difficulty of urinating. There can be the discharge, except that with gonorrhea, you're going to have more discharge than you would with chlamydia. Epididymitis, infertility again, trachoma, arthritis, and HIV complications. So the way it's diagnosed is exactly the same as what you would do for chlamydia. It's going to be the nucleic acid amplified test. Again, they're more specific, they're more sensitive. They've kind of replaced the culture test and the staining test. And these are kind of the gold standards for the way it's done now. Just like before, this is what the box looks like. They can get these at home. Patients can get it at home. They get them in the office. There's a picture of the actual organism there on the front of the box. It takes about 15 minutes, and it's detecting the antigen in this particular case. Gonorrhea is treated with the first-line medication being an antibiotic, ceftriaxone. This is pretty much your first line for any version of gonorrhea, and commonly because these are co-infections with gonorrhea and chlamydia, you'll also have the patients taking azithromycin, and that's more to knock out the chlamydia than the gonorrhea, although there is some evidence that shows that you can use that for gonorrhea. Pregnant women, again, are treated with azithromycin and erythromycin, and a particular concern with gonorrhea is that they're starting to see resistant strains. So they're starting to see the strains that are resistant to ceftriaxone as well as other antibiotics, again, because people don't take the full course of antibiotics. That's why the recommended treatment right now is the ceftriaxone, and it's actually recommended as an injection. That way there's no concern that it's not being taken like the way it's supposed to. Penicillin and cephalosporins are not effective for this one. I'd like to thank you for looking at this presentation. I hope you learned something. There's a lot of information. I had to kind of go through it quickly so that it didn't end up too long, but feel free to go back, rewatch episodes of this as you need to, and pause anywhere where you would like.